You know what a common cold is like, right? You feel just awful for a week, maybe two, but then it's over. But what if it wasn't? What if those symptoms, the stuffy nose, the sneezing, that sinus pressure, what if they just decided to move in and never leave? Well, let's dive into that exact medical mystery.
Seriously, just think about that for a second. This isn't just a cold anymore. For millions of people, this is their everyday reality. It's a chronic condition, a constant battle with their own nose. So if you're a doctor faced with a case like this, where do you even begin to look for clues?
Well, the first step isn't what you might think. It's not a physical exam. Nope. It's more like an interrogation. The doctor basically becomes a detective, and they start gathering clues from every single part of the patient's life to build a profile of the problem. And the investigation almost always kicks off with genetics. You know, a family history of stuff like asthma or allergies. That's a massive clue right off the bat. It tells the doctor that there might be an inherited predisposition, like a genetic blueprint that makes someone way more likely to have these allergic reactions.
And this is where it gets really interesting. Look at the level of detail here. The detective isn't just asking about, do you have a dog or a cat? They're digging deep for these potent, often overlooked triggers. Things like pigeons or chickens can be huge sources of allergens that most of us would never ever think about.
So now, the doctor is basically mapping out the patient's home in their head. Every single one of these things, dampness, carpets, even the AC unit, is a potential hideout for the big culprits like mold and dust mites. You can see how the clues are starting to connect and form a real pattern.
Okay, once all the questions are answered, once the verbal history is done, it's time to go examine the scene of the crime directly. The detective now puts on their examiner's hat and starts looking for actual physical evidence right inside the nasal passages.
And bam! This is one of the first, most telling signs you can see. On the right, that's what healthy nasal tissue looks like. It's pink and moist. But look over on the left. That is the classic sign of chronic allergies. The tissue is pale, almost bluish, and super swollen. It's a dead giveaway that the body's inflammatory response has been working overtime for a long, long time.
So, what is it that's actually swelling up in there? Well, let me introduce you to the turbinates. Think of them as your nose's own built-in air filters. But when they're constantly irritated by allergies, they can swell up and become permanently enlarged. This is a condition called hypertrophy, and it creates a physical blockage that makes it impossible to breathe properly, no matter how hard you blow your nose.
Now, to get a crystal clear picture of what's going on, the detective brings in the high-tech gear, a nasal endoscopy. It might sound a little intimidating, but it's actually a really straightforward process. First, a little anesthetic spray to make things comfortable. Then, a super thin scope is gently inserted, giving the doctor this amazing high-def view deep inside. They can see the turbinates, check for any other issues, and really confirm the true extent of the problem.
Okay, so with all the clues gathered, from the patient story, from the physical exam, the doctor can finally do what's called a differential diagnosis. It's basically a police lineup of the most likely suspects responsible for this whole mess.
And here they are, the usual suspects. Allergic rhinitis, that's almost always suspect number one. It's the ringleader, the underlying trigger. Now that constant irritation leads to our second suspect, chronic hypertrophic turbinitis. That's the physical blockage from the swollen tissue we just saw. But there could be accomplices too, like a deviated septum that's making airflow even worse, or maybe deeper issues like chronic rhinosinusitis. The detective's job now is to figure out who's the main culprit.
Now for the good part, the action plan. See, solving a case this complex isn't about some magic pill. It actually needs a two-pronged attack that goes after both the underlying allergic reaction and the physical damage it's caused over all that time. Think about it like this. On one hand, you have medical management. This is all about controlling the allergy itself, with sprays, pills, and avoiding your triggers. But on the other hand, if those turbinates are permanently swollen, medicine alone isn't going to shrink them back down. That's where surgical options can come in, to literally, physically create more space for you to breathe. And right here, this is the single most important thing to get from this entire explainer. Surgery can be absolutely life-changing for someone who can't breathe, but it only fixes the effect, the blockage. It doesn't fix the cause. The underlying allergy is still there, just waiting to stir up trouble again if it's not managed. Which brings us to the final chapter of our little detective story. Even after a successful surgery, even after that initial, amazing relief, this case is never really closed. That allergy, the root cause, it's a lifelong condition that demands lifelong vigilance. And you can see it laid out perfectly here. Surgery isn't the finish line, it's really the starting line for a whole new management plan. Look at it. Daily steroid sprays are absolutely essential to keep that inflammation down and stop the tissue from swelling up all over again. Avoiding allergens is crucial because that's what started the problem in the first place. And regular follow-ups? Totally non-negotiable if you want to protect that hard-won breathing room.
So we're left with this final thought, aren't we? When you're talking about a never-ending stuffy nose caused by allergies, the whole goal shifts. It becomes less about finding a one-time cure, and so much more about developing a smart, consistent strategy to manage the condition for the rest of your life. It's really about taking back control of your own breath.